right, welcome everybody. We are now live on Facebook and here on Zoom. So it is my pleasure to welcome you to Sun, Skin, and Safety with Cancer Support Community Delaware. I'm Erica Narducci, the program director, and it's my pleasure to introduce you to Monica Leibodi, who happens to be my niece. She also is a medical assistant at Ringfell Advanced Dermatology. I think I said that wrong. Um, but through her work, she has learned all about how to protect skin and reduce the risk of skin cancer. She graduated from the University of Pittsburgh in 2023 with a degree in bioengineering and will be attending the Yale School of Medicine Physician Associate Program this fall. Outside of work, Monica enjoys hiking with her dog and reading. So, Monica, I'm going to hand it over to you.
All right. Awesome. Thank you. Before I get started, I just wanted to double check. Can everyone still see my screen? Um, Great. Awesome. All right. Let's get started. So as my Aunt Erica already said, my name is Monica. Today we're going to be talking about the sun, the skin, and then just some general safety tips. I've been working as a medical assistant at a dermatology practice for the past 2 years now. So I've had the opportunity to learn a lot about the sun and the skin. And for this presentation, I did have my supervising physician review the presentation just to verify the accuracy. But just a quick disclaimer before I get started, I am a medical assistant, I'm not a provider. So this slideshow is just for information purposes only. I hope everyone can learn everything, but nothing on the slides should be taken as medical advice. So just wanted to get that out of the way, but let's get started. Okay. Did it move to the next slide? I just want to make sure. Okay, great. Sorry. So the skin, what is the skin? I know we all know what the skin looks like. We all have skin. But just to get into a little bit more detail, the skin is the outermost layer of the body, and it's our first line of defense. It protects us from external damage, such as physical trauma. It regulates our body temperature. It prevents loss of moisture, and it enables sensations such as touch. So in this diagram here, we can see that the skin is keeping the bad stuff out, like viruses, bacteria, toxins, and it's keeping the good stuff in, like moisture. So as you can see, the skin is super important. It definitely controls our internal environment. So we want our skin to be healthy and we want to protect it as best we can. The biggest threat to the skin is the sun. Now, I know we all like the sun. Hopefully with summer coming up, it starts to get a little bit warmer, but with more warmth with this summer comes more sun exposure. So it's important to be careful in the sun. The sun emits something called ultraviolet or UV radiation, and that can cause DNA changes in our skin. These DNA changes can lead to damage within our skin cells, and that causes sunburns, like in this poor woman in this photo here who looks super sunburnt. And this can be dangerous because too much sun exposure or too much ultraviolet radiation exposure over time and our cumulative sunburns over time can increase our risk of skin cancer. So it's important to be aware of how much sun exposure we're getting and the effects that it can have. You might be thinking, okay, well, what is skin cancer? Is it actually that big of a deal? The answer is yes, and we're going to talk about why. Today, I'm going to focus on 3 of the most common or well-known types of skin cancer, which are pictured here. From left to right, we have melanoma, and melanoma is typically the one that I think most people think of when they hear the word skin cancer. Here in the middle, we have a squamous cell carcinoma, or we call them an SCC for short. And then on the right is a basal cell carcinoma, or a BCC for short. So going back to melanoma, they are, out of these 3, the least common type of skin cancer, but they are the most dangerous. And that is because they can metastasize if they're left untreated. They can spread to other organs within the body. And at that point, when a melanoma has spread into the body, the prognosis is typically pretty poor. Now, these SCCs and BCCs, we refer to them collectively as non-melanoma skin cancers. They're more similar to each other and a little different than melanoma. As you can see, they look a lot different than melanoma. They also act a little differently too. They're typically more slow growing. They're a little bit more common, but they're less dangerous. So they don't typically metastasize or spread to other parts of the body. They certainly can, But that's pretty rare, and that would really only happen if these types of skin cancers were left alone, like for a long period of time. Now, that's not to say that they aren't dangerous. Even though they don't really metastasize, they can still grow locally destructive within the skin. And what I mean by that is they can grow pretty large, like in these pictures, they're pretty big. And they can also cause some problems. They can be painful, itchy, they can bleed. So typically we still like to take care of them. And in every instance of skin cancer, we like to treat them as soon as possible. The earlier we catch them, the earlier they are, or the easier they are to treat. And so just real quick, just some general risks for skin cancer. So first and foremost, as I mentioned earlier, that UV ray exposure typically from the sun is the biggest threat to our skin. So for example, if someone worked as a farmer for their whole life and they were outside, in the fields, in the sun, they are much more likely to develop skin cancers than someone who spends most of their time indoors, maybe working in an office. However, UV ray exposure is not just limited to the sun. There's also some artificial UV ray exposure, such as tanning beds. Those also really increase the risk of skin cancer. So dermatologists hate tanning beds. We definitely recommend staying away from that. Secondly, skin type. Someone who has a lighter skin tone or lighter in color is generally more susceptible to developing skin cancer than someone who has a darker skin tone. Third, a weakened immune system can also contribute. Our immune system is, of course, what fights against, bad things in the body. So if our immune system is weakened, we are unable to protect the body against skin cancer, and they can develop a little bit more quickly. And then finally, for melanoma, there is a genetic component. If your direct family member has a melanoma, then you are 8 times more likely to also develop a melanoma in comparison to someone who has no direct family history. Now, by direct family history, that includes your parents, your siblings, or children, but that doesn't include your grandparents, cousins, aunts, uncles. It's really only that direct family history. And this genetic component really only affects melanoma. Those BCCs, SCCs, again, those non-melanoma skin cancers, those really, there's not a genetic component. That is really only due to sun exposure and your other risks, such as skin type or the weakened immune system. All right. So now we know what a skin cancer is and what the risk factors are. I mentioned a little earlier briefly that the earlier we catch a skin cancer, the easier they are to treat. So we definitely want to catch them as soon as possible. But I mean, that being said, how do we do that? How do we spot a skin cancer? So something that dermatologists offer are full body skin examinations or skin cancer screenings. This is when they look at you literally from head to toe, every crack and crevice at every single spot. They typically offer this once a year or once every other year, depending on your risk factors. And that's just a really great way for dermatologists to keep track of what you look like and make sure that they catch something as soon as possible. It's also recommended to do a monthly self-examination, just maybe while in the shower or something, just kind of a brief look over, looking at yourself, seeing if anything has changed or if anything looks a little funky. It's always recommended to be better safe than sorry, better to get something checked sooner rather than later. And those monthly self-examinations can certainly help with that. But you might be thinking, okay, we're not dermatologists. How are we supposed to know what to look out for, especially during those monthly skin checks? That's a great question. And this slide, I want to be the main takeaway of the whole presentation. In general, when we're looking out for a skin cancer, we want to look out for the ugly duckling or something that doesn't belong, something that doesn't look like any other moles or spots. If you're looking at yourself and something, looks a little off, looks very different, that would be what we call a red flag or something to go get checked as soon as possible. But to go into a little bit more detail, what do we really consider the ugly duckling? The dermatologists that I work for use what they call the ABCDE method for melanoma. The ABCDEs are the 5 red flags of melanoma. Now, a melanoma can have all 5 of these red flags, or they can have just one. So any of these would be a reason to get something checked. And I'll just briefly go through it. A stands for asymmetry. So if you're looking at a spot and you were to cut it in half, if one side looked a lot different than the other side, that would be a red flag and a reason to get that checked. B stands for border, kind of goes hand in hand with asymmetry. If the border of a spot is really irregular or ill-defined, just kind of funky or wonky looking, that would also be a red flag. If you take a look at your moles now, I bet a lot of them look pretty round. They look pretty regular and symmetric throughout. That's what we want. That's healthy. Again, if something is asymmetrical or if the border is irregular, those would be red flags. C stands for color. Now, there are two things that can fall under this category. So a spot is really, really dark or black, just a lot darker than all of your other moles. That would be a red flag. Or on the other hand, a melanoma can sometimes have varying colors within. So if one spot has 3 or more colors, that would be a red flag. That would look something like light brown, dark brown, black. And melanomas can also have crazy colors in them like white, red, or blue, something you normally wouldn't see. So again, that's something to look out for. That's our third red flag. Fourth, D stands for diameter. Melanomas typically grow a lot larger than our normal moles, typically 6 millimeters or larger. And a good rule of thumb is the end of a pencil eraser is about 6 millimeters. So if something is bigger than that, that would kind of be a red flag, a reason to get it checked. Finally, E stands for evolving, or something that's changing over time. A lot of your normal moles will stay about the same size. They might change a little bit, but in general, the same throughout our lifetime. Melanomas are changing and they change quickly. So if something is quickly changing in size, shape, color, or texture, that would be evolving. That would be a reason to go get it checked. So that's our ABCDEs, and that applies to our melanoma skin cancers, which again are the less common, but the more dangerous type of skin cancer. Now, for our non-melanoma skin cancers, or again, those SCCs, BCCs, they're a little bit different. They don't necessarily follow the ABCDE rule, and they don't have their own acronym, which is a little annoying. As you can see here on the right, these are just some like comic diagrams, but these are some descriptions that we might use to describe a BCC or an SCC. They also look very different than our normal or healthy moles. So just kind of two red flags here to look out for. Something that is symptomatic or something that is itching, causing a burning sensation, if it's painful or bleeding, that's a red flag. If you want to look at yourself now at your moles, they typically don't bother you. They're a different color, but they're just there. These SCCs, BCCs, or also melanoma, they cause symptoms, so that would be a red flag. Secondly, these BCCs or SCCs can look a little similar to pimples or sores, blemishes, wounds, but a pimple or a sore, that's always going to heal. It might take a couple weeks, but it will always go away, even if you leave them alone. But these SCCs or BCCs, they do not just go away on their own. They stick around. So if you see something that looks like a pimple, it might bleed on you here and there. It might be itchy now and then. But if it's still there, even after several months, that might be a cause of concern. And that would be a good reason just to go get it checked by a dermatologist, just in case. All right, now some good news. We can prevent skin cancer. And the best way to prevent skin cancer is to use sun protective clothing, which is just clothing that really shields us from that UV ray exposure from the sun. So a great thing to do is hats. Like in this photo, this woman is wearing a large hat, which is great, really shielding her scalp, but also her face, her upper shoulders, and her neck. Long sleeve shirts are also great at protecting the arms. Long pants are great at protecting the legs. And there are also some clothing brands that have UV protection in the clothing. A lot of beach brands have this, going down to the shore. This type of clothing is really great, but also for other outdoor activities like gardening and golfing, when you're just outdoors for a long period of time, this is really the most helpful way to prevent skin cancer. But we can't totally cover our whole bodies. That's not realistic. So sunscreen is also super helpful. This should be applied everywhere, but especially on the areas of the skin that are not covered by sun protective clothing. The dermatologists at my practice often tell their patients to wear SPF 30 or 50 or higher. There's no magic sunscreen. There's no brand that's better than others. It's really just what you feel best with, what feels best on your skin, what will make you put it on every morning. Obviously, everyone's skin is a little bit different. Some skin is dry, some is oily. So the sunscreen that you use will kind of depend on your skin. So again, it's not worth it to spend hundreds of dollars on a sunscreen. Anything with the SPF 30 or 50 or higher will accomplish the goal. It's recommended to use sunscreen every morning. And a lot of people think that it should only be worn when it's sunny out. That's a common misconception. But sunscreen should actually be used even in the winter and even on cloudy days. The sun is sneaky. That UV ray is able to pierce through the clouds and it hits us, when we're unexpecting it or not expecting it. So it's really important to wear sunscreen every single morning. Additionally, if you are outside for a long time, so like for the summer, if you're going to the beach, if you're golfing, or just doing anything, sitting outside, it's recommended to reapply sunscreen every 2 hours. Now, we can't completely prevent skin cancer, even if we're great at, staying indoors and wearing sunscreen, it can still happen. But some more good news, they are in general fairly easy to treat, especially when we catch them early. When we do catch a skin cancer early, we can almost always treat them just in the dermatology office. It's a very minor outpatient procedure. We usually go to surgery first, and surgery usually involves cutting out the skin cancer with some extra margins to make sure it's totally gone. And then we send the tissue sample off to a pathology lab, and they're able to look at that tissue sample under a microscope and they can confirm with us with 100% certainty that the skin cancer is completely gone. So that's why we like surgery, because we know for sure. In some instances where skin cancer is caught very, very early and it's confined really to just that top layer of the skin, we can use topicals or creams, such as chemotherapeutics in the cream form. There are also some different laser treatments that work, and while creams and lasers are effective, we don't know with 100% certainty like we do with surgery when we send it off to that pathology lab. So that typically is why surgery is that first choice. In more serious cases, like when a melanoma has spread deeper, it's metastasized into other areas of the skin, patients are typically referred to oncology and they kind of take it from there. This is more rare, but it does happen. It's something to know, something to look out for. And I just want to emphasize that treating skin cancer is easy when they're caught early. So it's very important to catch a skin cancer early, knowing what to look out for, using that ABCDE method, looking out for the ugly duckling, and, seeing a dermatologist for those regular skin checks is also super helpful. And wearing sunscreen, sun protective clothing, preventing skin cancer. The earlier we catch it, the better. All right. So I know that was a lot of information. I wanted to thank you guys all for listening to me. I have some examples of sunscreens here. These are the ones that I like. But again, there's no magic sunscreen. It really depends on you and what feels best on your skin. But if anyone was looking for inspiration, I just wanted to have some photos here just for fun. And then before I turn the floor over for questions, I have a slide here too for some links, just for some more information, more resources if you were interested in hearing more. I think my Aunt Erica is going to share this with everyone afterwards. So just wanted to let everyone know that will be there. But all right, now I'm happy to answer any questions if anyone has any.